My name is Gladys Wachira, a health financing researcher at the Institute of Public Finance. Echoing Helen Rudy's iconic and timeless anthem, I am woman, hear me roar. The stark realities of women's healthcare in Kenya demand our attention and increased investments. Significant progress has been made within women's healthcare in Kenya. This includes the increase in access to family planning, where about 60% of the women have access to one form of contraceptive or the other. 2, we have had the increase in awareness of sexual and reproductive health rights among women, thanks to the increased access to information through digital means and increased advocacy by civil society organizations within the country. Despite this, some challenges still remain. This include the high maternal mortality rate in Kenya, which stands at 336 deaths per 100,000 live births. This translates to about 5,000 Kenyan women dying every year due to pregnancy-related complications. This is significantly high compared to the SDG target for about 76 deaths per 100,000 live births. Second, only about 66% of Kenyan women have access to 4 or more antenatal care visits against the WHO recommended number of 8 antenatal care visits. Third, only 62% of pregnant women have skilled birth attendants during their deliveries. The international target for this is 90%. Fourth, social health insurance uptake among women remains relatively low, with only 26% of Kenyan women having access to any form of health insurance in Kenya. This disparity becomes even bigger when you compare rural versus urban women, where only 20% of rural women have access to any form of healthcare insurance against 40% of urban women. These statistics point out a clear message: Kenyan women deserve better. Improved infrastructure investments in rural areas, coupled with initiatives targeted towards increased access of prenatal and antenatal care, as well as accessible and affordable social health insurance, are critical to ensure the attainment of the SDG targets for Kenya. Some of the key trends to look out for include the rising burden of non-communicable diseases in Kenya, particularly cancer. For women, there is a significant concern regarding breast and cervical cancer. And second, the impact of the new social health insurance reforms on financial protection for women. Overall, IPF remains committed towards advocating for increased healthcare allocations, equitable allocations, and also efficiency in resource utilizations within the country. Happy International Women's Day, #InspireInclusion.